So I knew all along, I guess starting in high school probably, that I wanted to go into some type of career in the medical field because I really liked science and math and those kind of things. And I had a neighbor who was a pharmacist at Walgreens and shadowed her a couple times when I was applying to colleges and trying to figure out what I wanted to do. And I really liked it. I just liked the way she was able to spend time talking to patients and helping them with their medicines. And so I went along that track and then didn't realize until I got to pharmacy school that you could practice pharmacy in so many different settings, not just retail, but hospital, doctor's office, research. So this was something new to me in pharmacy school. So I'm a clinical pharmacist with Wilmington Health, and I see patients for multiple reasons, really anything related to their medicine. So if patients are taking a long list of medicines and we're trying to make sure that they're taking the right medicines, right dosages, checking for interactions between their meds and also vitamins and supplements, and really just making sure that their meds are doing their job and not causing problems. So anything related to that, and then also for specific disease states like diabetes, high blood pressure, high cholesterol, to help get those under control, and working with the meds to fine-tune them and make sure that everything is working like it should. So I'm primarily working with primary care doctors, so our internal medicine and family medicine doctors here, and they usually refer patients to me for a comprehensive medication review, so to go through all of their medicines. There may be some specifically that they'd like me to focus on if cost is an issue or if there's specific side effects the patient is having. That's the most common reason I see patients. Also for specific disease states, like I mentioned, diabetes, high blood pressure, high cholesterol. The referrals primarily come from the primary care docs, but then a lot of patients also see specialists at Wilmington Health. So a lot of times I'm working with endocrinology, cardiology, some of the specialists after I see a patient if there's questions about their meds, or just to keep everybody in the loop and make sure that we're all communicating and we all know what meds they're taking, and just getting everyone's input on things. So I think just along with what's been called the triple aim of healthcare, where we're trying to improve quality, reduce cost, and improve patient experience and satisfaction with their care, that all can be affected by a pharmacist. So we're really trying to use their meds to improve their health outcomes, keep them safe, reduce cost of care by making sure they're on the least expensive but also the most effective medicines for their conditions, and then improving their understanding and their quality of care as well. And I think you can also throw in a fourth aspect of that, which is provider satisfaction with care. So we're also trying to help primary care providers and specialists treat their patients and manage their patients and take some of the burden off of them, because when you see a patient with 40+ medicines, it's often hard to address all of them during a 15-minute visit. So we're also here to serve the providers and help them out. I can think of a patient I saw recently who has a pretty extensive history of stents and heart attacks, and was on a lot of medicines for her heart. Her stents were several years in the past, and she'd been on these medicines for probably 10 years at this point. So she's gotten older in the meantime, and some things have changed with her medical conditions. Her kidney function had declined a little bit since she was started on some of the medicines, and so she came to me and we were just looking at her meds because she takes so many and was really trying to cut out things that she didn't need, was having some trouble with bleeding and was on a couple different blood thinners. I worked with her primary care doctor and her cardiologist, and we were able to cut out one of the blood thinners. She was also on, I think, 3 medicines for her cholesterol, and her cholesterol was great. So a lot of these were meds that just stayed on over time, and when we really evaluated whether the risks of the medicines outweighed the benefits, we decided that some of them they probably didn't at this point in her life, and we're able to cut some of them out and reduce her chances of side effects from the medicines and make her life a little bit easier, not taking so many pills every day.